Adverse childhood experiences are incredibly common. 1 out of 7 children in the United States experiences child abuse and neglect. Over 35 million children in the United States each year are exposed to some form of violence, some form of adversity. So these experiences are more common than we're willing to admit. That's one reason why it's so important to be concerned about these exposures. It's very common. Not to say that every adverse experience is going to lead to a health problem, but when you have that type of exposure in a population where almost half your children in each year are exposed to some form of adversity, and you understand that those adversities lead to mental health and physical health problems, it really raises a red flag of concern.
The ACEs are, fairly widespread in terms of looking at some of the data, especially when we've looked at, some of the population data. One of the ways that we've tried to quantify ACEs is there are several different questions that ask about those adverse childhood experiences. From things like a parent being incarcerated, a parent having mental illness, a child being exposed, or actually they're adults, but when they were children, being exposed to physical abuse or sexual abuse. And so of those range of questions, one of the things is we've tried to measure is how many people were exposed to 0 ACEs, how many were exposed to 1, 2, 3, 4, 5, 6, all the way on up. And so we find that, there's probably around 40% of the population that probably had 0. And there's a good proportion of the population, a little bit over 12%. So probably about 1 in 8 that have been exposed to several of the ACEs. So, 1 in 8 adults that have been exposed to the ACEs, in which we believe there are health consequences for that, is a pretty big population that we need to try to be addressing and try to do something for.
In the absence of protective factors, exposure to childhood adversity can increase individual risk for future violence, unhealthy and unsafe behaviors, and poor overall health and wellness. While these potential outcomes exist at an individual level, they can create a cycle that's difficult to break. Children have an increased risk of exposure to ACEs when their parents or caregivers have a history of ACEs. And if the cycle repeats, ACEs and their consequences can echo across generations. Take Paul, for example. Paul's parents had difficult childhoods. They didn't have good role models growing up, nor did they have community support when Paul was born. Paul's dad had a hard time finding work, and his parents were constantly fighting. They struggled to provide for their family on less than adequate wages, and they had limited access to resources like childcare and tax credits that could have reduced the stress level in Paul's household. As a result of these factors, Paul experienced ACEs as a young boy. There was a good chance that these experiences could have had long-term consequences for Paul and even for his kids and grandkids down the line. Paul could have dropped out of high school and struggled to find steady jobs like his dad. He might have developed chronic anxiety like his mom. He could have lived in poverty throughout his life. If these things happened, Paul's children would have been at high risk for ACEs, and the cycle might have continued. But this didn't happen. Paul found mentors and friends at the local community center where Paul's dad enrolled in a free job training program. A local hospital partnered with Paul's school to conduct health fairs for the community, and Paul's parents were linked to counseling services that helped them develop healthier ways to cope with stress, communicate with each other, and practice positive parenting. Furthermore, Paul's family and his entire community benefited from programs and policies such as nutrition assistance, public transportation, tax credits, livable wage policies, and public awareness campaigns designed to support families and shift social norms. All of these things helped Paul thrive. Sure, he had ups and downs throughout his life, but numerous factors protected Paul from the effects of adversities he experienced as a child. His family and community gave Paul a sturdy foundation that enabled him to grow into a healthy, happy adult and a supportive father and grandfather. The intergenerational cycle that ACEs can create stopped at Paul. When we consider the number of people affected by ACEs, the range of negative outcomes they can lead to, and the potential to intervene, the case for prevention is clear.
Children who experience early adversity are less likely to graduate high school, and they're more likely to be unemployed and living in poverty as adults. What that means is that their children are now living in early adversity, experiencing early adversity, and are themselves at greater risk of not completing high school, being unemployed as adults, and living in poverty. It helps us to see how early adversity can be passed from one generation to the next, but also how poverty is cycles from one generation to the next. As a society, we can disrupt these cycles with policies that support economic conditions for families, that help to lift them out of poverty through programs and policies. We also could break the cycle of poverty by improving access to high quality education for all children, to be sure that all children are able to not only have high quality schools, but to be able to learn in schools.
We need to look at why it is that some children are more at risk than others. What puts them more at risk? What are the conditions that they're living in? And what are the policies that can impact those conditions? For example, safe and stable housing, a livable wage, access to early care and education can be really important.
I think it's important to keep in mind that an ACE score doesn't label a person as having an easy or a hard future. Many children who have experienced severe adversity, prolonged adversity early on, are very resilient, very strong, and go on to lead very productive, happy lives. There are individual factors that make some children more resilient than others, and there are environmental factors as well. So we tend to see resilience increased when children have a supportive person in their environment. That doesn't have to be the parent. It could be a teacher. It could be a school coach. But somebody who can help them, support them, believe in them is tremendously helpful. Also, children who believe in themselves and have a sense of purpose about their lives and a strong sense of self, strong self-esteem, they tend to have more resilience and be able to handle adversity better than children who may lack those things. So there are certain personality characteristics and traits, as well as social factors that can really influence a child's reaction to stress.
Take a moment now to answer a few questions about Lesson 3.